Icotrokinra is going to be the topic of discussion for this video. Hello dear students, myself Dr. Maddineni Srinivas. Welcome to my YouTube channel. So if you are not yet subscribed, please do subscribe to this channel. So you are going to get all the latest updates regarding dermatological diseases and the medications. So as you can see here, it is recently approved on March 18, 2026 for the patients of psoriasis. And it is not a topical, it is not even injectable, but it's a oral medication available as this 200 milligrams tablet form. Very interesting, isn't it? So this is a cyclic peptide which is designed for the precision of a biologic but in a oral form. This is not a JAK inhibitor, tyrosine kinase inhibitor, but it's a cyclic peptide, and we can say it is a first in class targeted oral peptide molecule which is going to act as an antagonist against this interleukin 23 receptor. So by antagonizing the interleukin 23, it is going to reduce the Th17 signaling. That is, it is going to reduce the pro-inflammatory cytokines, which are IL-17, 22 and IL-19. Ultimately, it will halt the keratinocyte hyperproliferation in the skin, thereby reducing the scaling in the patients of the psoriasis clinically. So this is the molecule which is blocking this interleukin 23 receptor, thereby it is going to reduce this pro-inflammatory cytokine production downstream. And it will reach rapid steady state in a period of 3 days, and it is going to have very minimal drug-drug interactions because it is not metabolized by cytochrome P450 enzyme system. Coming to the efficacy, it is demonstrating clinical superiority over the molecule deucravacitinib, and it is indicated for the patients of the psoriasis, no doubt, but it should be moderate to severe type of plaque psoriasis, but not mild form. And obviously these are the candidates who are for systemic therapy or phototherapy. So in them we can plan to start on this molecule, and also they should have an age more than or equal to 12 years and also weight more than or equal to 40 kilograms. And it was observed that they are having 70% of the improvement, showing clear or almost clear skin within a period of 16 weeks, and also PASI score improvement has also been observed. The dosing is also very important and very interesting. So this is an oral form available as once daily 200 mg tablet, but remember it should be taken on an empty stomach. Very important instruction which we should give to the patient. If it is taken with food, then it's going to have reduced efficacy. That is the important point, remember. And also the patient should wait for a period of at least 30 minutes before taking any food or liquid other than water. And if the dose is missed, then what patient can do is take as soon as possible on an empty stomach. And if a day has passed without taking this medication, then they should resume the normal schedule the next day, but they should not double dose the tablet. And tablet can be dispersed in water for the patients who cannot swallow because of the dysphagia issues. Coming to the safety and monitoring, remember the safety profile is highly favorable, looking very much biologic like, with adverse event rate very less, just like a placebo. So what is the important pre-treatment evaluation which we must do? That whether the patient is having any active or latent TB, we should try to investigate for this. And also update about the age appropriate vaccination should be mentioned in the history. And routine monitoring, what we should do is we should observe for any clinical signs of infection, particularly of those of fungal infection and any symptoms of tuberculosis. Right, adverse events, the most common adverse events which are observed in the patients are nasopharyngitis and upper respiratory tract infection. Apart from this, others like headache, nausea, cough, fatigue, localized fungal infections is also observed in the patients who are taking this medication. Coming to the rare form of serious adverse effects, you can remember there could be some GI issues, so we should be taking care of monitoring the patients who are on this medication very carefully for any GI symptoms. Precautions: use with caution in patients who are having moderate to severe renal impairment, that is eGFR if it is less than 60. And also when the patients are on this medication, we should advise them to avoid any live vaccination, right? We can say Icotrokinra is an ideal option for patients who suffer from needle phobia, who are cycling, who are changing the topical therapies without any relief, and also who want biological level clearance without the injections. So this is all about Icotrokinra. I hope it was helpful. If so, please do the like button and also do comment any other